Hello folks, this is Dr. Phil at the LaserMed Pain Institute. Today we're working on Matt's shoulder. He's a college football player and he has some tears in his labrum and rotator cuff. And right now we're doing what's called the laser edge technique, and we're breaking down adhesion and scar tissue and bringing blood to the area to give the shoulder a chance to heal. And after we break it down with our laser edge tools, we're going to do some class 4 laser therapy, which is going to shoot photonic energy into his shoulder, which will accelerate the healing process multiple fold by bringing in blood, oxygen, and stimulate stem cells to heal his shoulder joints. Okay. But first, we're going to do the laser edge technique. Right here. And what I like to do is, I check the sits muscles, the rotator cuffs. We have the supraspinatus, spinous scapula, supraspinatus, infraspinatus, teres minor, and your subscapularis. Okay. And so underneath here, I want to check in abduction and external rotation how much he has, which will check the integrity of the subscapularis. So you can see right here. Tell me when it starts hurting. Right there. So almost right away.
Oh, okay.
I can't even rotate that thing.
Okay.
Let's go compare that to this shoulder, which has more of a normal mobility. Tell me when it starts hurting. See how I could externally rotate that, and I have some end play. And he does have some pain, but it's not till the end, right? So look at that rotation there. This is how it should be, and that's what we want to restore. So I start out with the half moon scanner, okay? And this is your latissimus dorsi, attaches here, and it kind of ties in right above that. You can feel the subscapularis right in the axillary pit here, and that's what we want to release. Okay, because what happens is when you tear the subscapularis, you get adhesions, and that decreases your shoulder joint's ability to do that external rotation. So you're not going to be as mobile on the field, obviously. You're not going to be able to do as much exercises, such as presses. Even pull-ups will probably hurt because you're not getting that full range of motion. Overhead pressing would not work very well. So we want to restore the mobilization before we add more aggressive strengthening exercises. Okay. So what I like to do is I kind of use a little active motion while I release the subscapularis joint. So right here, I'm just putting his arm in a little extension, and you could feel those adhesions breaking. You feel it feels like sandpaper? Yeah, so with motion, we don't have to apply as much pressure, and again, the logo is facing away from the skin surface. The logoless side is towards the skin surface on about a 45-degree angle. And again, so I got the grip tech, so I don't have to really white knuckle this, which makes it a lot better. So after the half moon, I take the tongue depressor, and I can be more specific in getting into that subscapularis muscle. You can feel those adhesions breaking. And what I do is I make this more like an active with motion. So as I put that in rotation, I'm breaking up those adhesions to make it a little more sport specific, position specific, bring that adhesion out in the active component that it hurts, abduction, external rotation. It's not going to be the most pleasant feeling down there, but he's a tough guy right here. 1, 2, one more, 3. Okay, let's retest. Shake that out a little. Good. Okay. Tell me when. Look at that. I mean, that's like, it's almost like about 50% more rotation, wouldn't you say? And when did it start hurting? Okay, in the same spot back there. Now, is the pain intensity the same, or is it less? Okay. How many percent improvement if you had to put a number?
30-40%.
Yeah, and that's just one treatment. And after this, what we would do is, well, obviously we put the protective glasses on here. Just put those on. And we'd use our class 4 250 watt laser, which would put photonic energy inside his shoulder and increase the healing response 10 times to 100-fold by putting in photonic energy into the subscapularis muscle, increasing circulation, stimulating stem cells for healing, stimulating nitric oxide production to dilate the blood vessels, to bring in blood flow for healing as well. So the red beam is just an aiming beam. The actual photonic energy, the healing spectrum, infrared, is invisible to the human eye. So that's how we treat the subscapularis muscle. If you want to treat the other parts of the rotator cuff, why don't you sit at the edge of that bench so I can see the back. So again, we take the emollient here. You don't need a lot. My staff likes to waste it. You know, come on, it's precious stuff. So with the rotator cuff, I'm going to work on some of the supraspinatus muscle, which attaches here to the spine of the scapula, the border, and it comes across to the humeral head across here. Okay. So what I like to do is just spread the emollient around. Origin insertion. Supraspinatus. And really the orthopedic test is a lot of times you get an impingement syndrome. So let me see. I'm going to press. Feel any pinching in there? And where do you feel it? Right? Yeah, right back there. Okay? So loosen that up too. And it comes right across. And you can feel some adhesions here as well. Okay? Now, since he has a big shoulder joint, you can use the handlebars here, getting the logos away from the surface of the skin, and we can break up those adhesions with the handlebars right here. And so I can use a fanning motion. See, superior to inferior is along with against the grain, which you could break up more. And you can use a scooping motion right here, kind of like framing the humeral head. And you can work out the deltoid muscle right there. Get up here, and what you can do is have them hug here, and that will make the skin tight so you have better contact, a little deeper contact, getting those tendons, fibers there. We can work to the infraspinatus below the spine of the scapula here. You could fan out like this. Fanning pattern. Again, inferior to superior seems to work better for him. I could do a scooping pattern, just get right under that spine. Work under that. You could take the tongue depressor and work along the borders of those bony tuberances. So you don't want to raw in the bone because that could cause contusion or a myositis ossificans with repeated pressure. So you want to kind of work around those bony protuberances in between. Get in the teres, right in there. Be more specific like that. Okay, now let's say if his impingement is improved just by that. So tell him when it starts pinching. Alright, seems like we go a little better. So go ahead and put those glasses. So again, after the laser edge myofascial release tools, use a high powered class 4 laser. Deliver that healing photonic energy into the areas that we just worked on. So here we want to get even some of the biceps tendon right here, because a lot of times the biceps tendon acts like a pulley because it is attached to the shoulder joint here, and if you get adhesions in the biceps tendon, it's going to affect your shoulder mobility, and you can actually tear the biceps tendon there too. That's why we like to treat that as part of the shoulder complex. Crispinatus, Teres. And I showed you subscapularis earlier. Also want to make sure, if he's not responding well, there might be an impingement in the C5-6 nerve, which has branches to control the deltoid muscle and rotator cuffs. You can even do a C5-6 stimulation with the laser right there. You could even try some decompression on that spine as well, some mobilization manipulation. Okay? So those are your basic shoulder protocols using the laser edge technique along with the laser. Next session, we will show you our next anatomical area we're going to treat. So thank you for watching Laser Edge Class 4 Laser Technique TV. Thank you.